Okay, I think then I will do that then, because I would quite like to create as much space as I can for the end of the meeting, when we will move into private session, primarily to enable ourselves to have a first governors discussion of the biggest piece of news for the trust at this stage, which colleagues will be aware is the Chief Executive's announcement that he'll step down at the end of June. I'll do more housekeeping in a minute, but I just wanted to open the Governors Council meeting, as I did the public board this morning, by thanking Bruno for his leadership already. We've got a bit more to get from you yet, Bruno, but I want to say how much I've enjoyed working with you personally, but also to thank you for the leadership you've provided to our trust over the last 6.5 years, and particularly though during the COVID period, which I can't imagine you anticipated would be part of the responsibilities that you had as Chief Executive when you came to Oxford, and have challenged health organisations all across the world. So before I go to the sort of housekeeping bits, I just wanted to put that on the record. And Bruno, I don't know if you want to say a little bit more to sort of put flesh on the announcement that's been circulated to people.
Yeah, Jonathan, thanks for the kind words, and it's been a pleasure to serve the trust in the past 6.5 years, and still a few more months to go as well, Jonathan. Not gone yet. But yes, indeed, the last 2 years were probably difficult for all of us in terms of personal and professional lives, but I'm pretty optimistic that with Omicron, hopefully the peak behind us, that we're moving into a new normal, and the decision to step down is motivated by my wish to work fewer days and more flexible days. And so that will allow me to travel and spend time with friends and family, which most people on this call know are living in different parts of the world. So that's a bit of the background. It's been a bit of a bombshell to drop it in the team, but I think we're recovering, and look forward to the next couple of months still as Chief Executive.
Thanks so much, Bruno. And there will be other occasions to explore those things more informally, but I wanted to open the council meeting with that. We have most of the non-executive directors, I think, with us on the call. Joy is unlikely to make it because she's had to deal with some issues in her own organisation related to COVID absences, and Gavin is unable to be here this evening. We have stood down executive directors other than Bruno for today. We've done that as part of a general attempt to streamline our governance processes over these few weeks where COVID pressures remain quite intense on the trust, and Bruno will brief us a little bit more about that slightly later on in the meeting. And then we will release Bruno to enable us to deal with some internal housekeeping about our own governance, but then also to have an opportunity in private session just to kick off some of the thinking about the process for Bruno's replacement. And I think the key thing to say about that is that we're not quite sure yet what the details of that process is going to be. But under our constitution, the responsibility sits with the non-executive directors to appoint the chief executive, but subject to this council having to approve any appointment that is suggested. So we want to early on get as much wise counsel as we can from everybody, including this council, on what we're looking for, and then we can begin to shape the process by which we find her or him. So I'm hopeful that we'll be able to get through the sort of formal business reasonably quickly, and then that maximises the amount of time that we can discuss our thinking in terms of how we move forward. So the first bit of formal business is the minutes of our October meeting. Are there any corrections to those minutes that need to be made? Can't see anybody, so thank you very much. Matters arising, we don't have anything on a formal action log at this stage because there are no formal actions open. What we do have is a membership and strategy working group underway, which has now met, and the expectation is that an updated strategy around membership will come to us probably in either April or July. That depends on how quickly the proposals emerge. So just to reassure you that is underway. I don't think there are any other matters arising. In which case, there's a few things I should report in relation to items under the chair business. I've obviously already mentioned Bruno's impending but not immediate departure. We should also note that the creation of the Integrated Care System Governance Board has been now deferred until July, although the process for recruitment of non-executive directors to the ICS is underway. I think will have briefed people that we have the chair designate Javed Khan announced and that James Kent has been confirmed in the chief executive role. I have my first opportunity to meet Javed, albeit virtually, later this week, and I will encourage him to build a relationship with the governors. And I know that some work has already been underway in terms of linking the ICS with the lead governors. I can't see if Cecilia's on the call. Cecilia, you're on the call. Did you want to say anything about the meeting with lead governors around the ICS?
Oh, yes. Have you got me now?
Yes, I have.
Oh, good. Yes. Basically, the governors, a group of governors from our trust have met members of Oxford Health Trust. We've had some discussions. There's been another meeting across the BOB lead governors, including the South Central Ambulance Service. And we've written a letter to Mr. Khan regarding a meeting with governors. There was a very rather hastily called meeting arranged by the BOB ICS to discuss patient engagement. They invited the lead governors and a lot of representatives actually from the various areas of Health Watch, which I thought was very reassuring. And all I can say is, from what I gather now, that they are going to appoint a director of public engagement and communications. And in the meantime, they've got an interim, well, not an interim really, he's a consultant who's helping them set this work up. He is an expert in this area. He's done a lot of work over the last 30 years with the NHS. So anyway, we await this space, but we are very encouraged by the communication, particularly with Oxford Health, because there seems to be a great emphasis on working at place, and perhaps we work at place with fellow governors down here and communicate with Health Watch. Anyway, it's all still very, very new, and I can't report much more than that. Thank you.
Thanks, Cecilia. I think I'd like to try and put a positive spin on that. We spent a lot of time trying to get the ICS to engage with the importance of having structures for public and community engagement, and at least they're focusing on that, which I think is a step forward. But I think we will keep putting pressure on that. So thank you. So that's, I think, the update on the ICS structures.
Jonathan, I'm sorry to interrupt, but Anita's got a physical hand up. Might not be able to see her.
I can't see that because I can only see a few at a time. Anita, sorry. Anita, you've frozen on my screen. Can you hear us, Anita? I'm going to move on. When Anita's connection improves, hopefully she will interject and we can go back to that. I wanted to report one other item for external partners, and then there are a few internal things as well under my business. The external partner is to say that we've heard yesterday that Oxfordshire County Council will begin a recruitment process for a new chief executive shortly. We don't know any more about that at this stage, but obviously our partnerships are extremely important to us in terms of being able to operate the system effectively, and we will aim to keep you briefed on that. And then I've just got 3 internal things. One is that we had originally intended to bring today the recommendation from the working group overseeing the appointment of the external auditor, but that recommendation isn't yet ready. We hope that it will be ready in February, and we have a scheduled date for a seminar in February. At this stage, we're not sure what the business might be for that and whether it should be face-to-face. So I think we would like to people to keep that in their diaries for the moment, and we will get back to you as soon as we're clear what the business might be. And then the final internal thing is an update on the governor elections, which we have a few more days open for nominations. And I just wondered, Caroline, whether you could update the council on whether we have a highly competitive rate stuff with candidates or whether we're a bit anxious about some of the constituencies. Caroline, are you there?
Sorry, yes. Nominations are coming in. We've got a couple of constituencies where we haven't received nominations yet, but I know at least in one somebody is going to nominate themselves. Quite often people leave it to the last minute, but at the moment in the majority of constituencies we've got people standing, and hopefully more will join them.
Thank you. I don't think I want to encourage public discussion in response to that, but privately, the more competitive our elections are, I think the more credibility those elected have, and therefore we should be keen to encourage people to stand. Anita, you had connection problems, but I think you wanted to raise a question, so you're welcome to that now.
I was only going to ask Cecilia. I was very interested in what she had to say, and I think it would have been helpful had she perhaps sent us the odd email in order to just keep us in the picture, because that was all news to me, and of our link, of our work with Oxford Health, etc., etc. And it would be helpful if perhaps if you've got the time just to send a brief email to say what's going on, because that was complete news to me.
Anita,
yes,
this is all very fast moving, and we might think about the best way to do that, perhaps incorporating it into the messages that I send regularly to people.
Yes, that would be the way to do it, possibly. Yes, thank you.
Can I just follow up on that? Really, all of this has been absolutely happening in and around Christmas and in the last week or two. It's been terribly fast, and this was really my first opportunity to present. But I will say that I'm very encouraged by the positive attitude of fellow governors.
No, I agree, and that's true. It's just that we always have to remember this notion that what happens in Oxford counts, but what happens in the rest of the county often gets sort of forgotten about. That's the fantasy.
Thanks, so I think the action is then for Caroline, you and me to incorporate Cecilia in the checking of anything that needs to go out on the regular briefing. Caroline drafts and we send out. So we'll take that action away.
Thank you.
Thank you. I think those are the only issues of Chair's business. And Bruno, I'd just like to give you a chance to tell the council a little bit about what's going on in the hospital at the moment. And over to you.
Yeah, Jonathan, quick update in terms of operational pressures. It is still very, very, very busy, but the Omicron wave seems to have had its peak, at least in terms of the impact on the trust. Some key metrics are that at the peak of Omicron, we had about 125 patients with COVID in the hospital. That has now come down to just below 100. And also staff absence because of COVID, self-isolation is coming down. So those are two good indicators that it is likely that we'll have the peak of Omicron behind us. We're still at high levels of pressure because of staff absence and still the volume of patients that come to A&E is very high. And we have also issues of getting patients back to a different setting or home, with still a number of acute beds being occupied by patients that are medically fit. So the trust is still under quite a lot of pressure, and I just want to take, because I see a number of staff members also on the call, just thanking them and all the other colleagues for the relentless commitment that we've demonstrated over the past 2 years with waves that come and go.
Yeah.
And we were hopeful coming out of the summer that we would see the end of the pandemic, and then Omicron surprised us all. But hopefully now this time, again, crossing fingers, we can see end at the tunnel, and hopefully there will not be another variant surprising us. But if that's not the case, then hopefully we'll come into a more stable situation in the next couple of weeks.
Thanks, Bruno. I'm going to throw it open for questions. Board members had a chance to go over quite a lot of this field during the day, and one or two things that came up, like where we are in terms of waiting lists and cancer, that we might re-ask if no one else does, Bruno, just so that you can share the answers with the council. But I'll throw it open first of all, and I have Cecilia to go first and Tony to follow. Cecilia.
Thank you very much. Bruno, we did cover with Terry Roberts at PWF the other day the issue of the staff and vaccinations and the requirements that are shortly to come in requiring patient-facing staff to have had their vaccinations. I saw that there was a very full paper that came to the board today, but I think it would be very reassuring if you could just briefly summarise, you know, the and the tactics that tactics isn't quite the right word, but the response of the trust. I think this is very important. I will say I thought that our committee felt very reassured about the general compassionate view that was being taken, but I think it would be helpful at this point for you to fill in a little. Thank you.
Thanks, Cecilia. Just to say that we are trying to avoid discussions in ways that might lead to individual staff being implicitly identified, and this is a public meeting in the sense it's being videoed and will be made available. So Bruno, if you want to talk to that without identifying individuals, I think that would protect any confidentiality. The board discussed in private some more detail on that, and I would be able to pick that up when we get to private session and relay what we heard as necessary. But Bruno, would you like to deal with the general issues about our approach, which is what Cecilia's asked about?
Sure, Jonathan, and we had a discussion at public board this morning as well on the topic, and that's also available online. Fortunately, the overwhelming majority of our staff are fully vaccinated. Just want to get that on the record. We have a number of staff members that we're still not 100% sure, because we can't match the records to identify if they're fully vaccinated. So each and every single one of those staff members are being contacted personally to just understand if they're fully vaccinated, and if not, what are some of the barriers that prevent them from getting the vaccination. So I'm very pleased to hear, Cecilia, that at least you pick up that we're doing this in a very compassionate way.
Absolutely. Thank you.
Thanks, Cecilia. I should say the board is also aware that there are some business continuity risks that might emerge. Our priority at this stage is understanding why people may not be vaccinated and giving them the chance to be vaccinated. The board will, in a few weeks' time, when we have a clearer picture of whether there is a significant residue of people who are not going to be vaccinated. There are obviously questions that might emerge about the impact of that on services, and the board has agreed to have a briefing about that in a few weeks' time and be able to assess what those risks are. But we're not in a position to quantify those at the moment because we're still having the conversations with individuals. I think that's fair, Bruno?
Correct, yeah.
Thank you. Tony? You're on mute still, Tony.
Can you hear me now?
We can.
Okay, thanks, Jonathan. A couple of questions I made to Bruno. First one relates to the Omicron situation, and it's believed that the Prime Minister might well take all relaxation off, all restrictions off next week. Where do we stand with
he
the
said he has done, Tony. You said it this afternoon.
I'm sorry, I can't keep up with the news moving so fast. Okay, so he's done it now. Where does that leave the hospital? Are you still going to be extremely cautious? The reason I ask that question is if we're trying to get back to normality and we're still sort of being very careful who comes in the hospital, the masks and all that, is there going to be some relaxation on those restrictions, or are you still going to keep as tight as it is?
Still as tight as it is. I need to, again, inform the governors that we're hopefully having the peak of Omicron behind us, but it was a significant wave and a significant peak of infections with significant impact. I mean, people have been admitted to the hospital, and again, unfortunately, we've had people who have lost their lives in the past wave. So this is still a deadly disease, and we need to protect our staff and our patients against infections. So we will keep the IPC measures as we currently have in place in the hospital.
Okay, well, it's obviously a good answer, and I guess we're going to see it for a long time yet. The second question related
Sorry,
to...
Tony, just before you leave that one, I mean, we've just been discussing that in the Oxford System Leaders Group and looked at coordinating the messages that we put out across all the various organisations, local government, statutory sector, police, etc., to try and be clear what the situation is. And of course, the situation is that the community infection rates remain much higher than we have been having in the past. That Omicron has not led to as many people being in hospital, but for those who are in hospital, whether it's for COVID or something else, they remain vulnerable, and we really don't want them to contract the virus. So while we can return to normality to some degree as a community, it would not make sense to take the same view inside the hospital, because by definition, the people who come into the hospital are much more vulnerable than the general population. So that's we'll try and get that messaging coordinated, Tony, across the system so we can be clear to people as possible. And your second point, Tony.
I'm sure it's going to be the same with the community health situation as well. The second point, watched a news item last night at the JR with regards to body cameras. Is it really a massive problem in A&E and elsewhere where it is going to be necessary to wear cameras?
Yeah, Tony, thanks for the question. And it is a big issue. I want to confirm that. So violence and aggression has increased significantly.
Terrible.
And our staff members sometimes feel very unsafe. And so, yes, we have a significant campaign to try to reduce violence and aggression, but also to protect staff members against potentially incidents that where they could come to harm.
Yes. Do we have a root cause for this though? Because I can imagine some patients coming in are they're very annoyed they've come in, they're annoyed they've got in this situation. So I can understand them sort of waving their arms around and giving some abuse. But has this worsened? Is there a root cause for why you now need cameras?
The pandemic, I mean, without going into individual cases, the pandemic has had a significant impact on our communities with a lot more sort of stress, mental health impact. I mean, it's well documented. And so clearly the pandemic has had an impact on the level of stress in society.
Okay, thank you.
And just to be clear, Bruno, the body cameras is a pilot, isn't it? So we will be able to evaluate whether it does increase the safety of staff and other patients in the environment. And we may learn something, Tony, about the point you're raising about the causes from that pilot.
And hopefully there is a root cause we can deal with, but it could be a long way away yet. Thank you.
Thank you. Nina, and then Helen after Nina.
Thank you, Chair. And thank you, Bruno, for explaining the body cam position really clearly. Again, still on the subject of staff safeguarding, there has been an article in the Times of this week on Monday about surgery's Me Too moment. And this is about sexual harassment among staff of each other. And I think the mood in the market is, with recent cases such as Prince Andrews and Ghislaine Maxwell, I think people are expecting to have much more accountability, and there's much more transparency, and therefore safeguarding of staff in those situations becomes a much higher profile issue. Not that it shouldn't have been before, but I think the public mood has now outstripped what the regulation might be. So I just wonder whether we are making any efforts in that context, not that we were named in any way, but because the focus at the moment is so much on dealing with the pandemic and dealing with waiting lists, I just wonder whether we need to keep some focus on those areas of staff safeguarding as well. What's your view?
No, absolutely. And I mean, I think we all are clear on that these things are unacceptable, and we know what are unacceptable behaviors. We also have ways for staff members to signal if that would happen, if they would be confronted with those unacceptable behaviors. Yeah, as with violence and aggression also, yeah, these things are just really important behaviors to just check that they're not happening in the trust. We're of course also counting on people to use the existing procedures to let us know if they are happening, so that we can indeed deal with specific incidents if that would be the case.
Yes, thank you. Sorry, Bruno, sorry to just ask you a follow-up question to that, if I may, Chair.
You may, Nina, and I'd also like to make a comment on that as well from things that I'm aware of. So, Nina.
Thank you. So the whole issue about that is as became apparent in the Ghislaine Maxwell case, and is also described in the article that was published in the Times, that the victims are very often very reluctant and very damaged, psychologically damaged, to be able to take a position on it. And that is often seen as a way out by the current procedures in many NHS establishments, because the frameworks that exist to protect them don't actually allow for that. So it's just a case of keeping an eye out and daring to be different in terms of being able to identify, support, and resolve.
So, Nina, I think I can definitely confirm to you that in a very small number of cases of this sort that have come to my attention because they've been picked up in relation to staff who go through one of our formal procedures, I'm very, very confident that we respond appropriately and we protect those who raise those sorts of questions. And we don't contain things within the trust, because that's often something that goes wrong. We appropriately involve police and others as necessary. We do refer to the professional regulators as necessary. So there are one or two examples of that have come up in my time, and I'm very confident in the responses. More generally, we have put considerable amount of effort over the past few months into publicising our freedom to speak up processes, and Claire Flint, who may want to comment on this, is the non-exec in relation to that. A number of non-execs are involved in some of our staff networks and therefore have the opportunity to pick up from people concerns. So I'm not confident that we know about everything, but I am confident that when things emerge, the senior staff respond appropriately, and we aim to make it as easy as possible for those concerns to be raised as we can, and we certainly aim to protect staff who raise them. So I think we're aiming to do the right things, but of course, like any other organisation, you never get it perfectly right. Claire, I don't know if you want to comment from a FTSE point of view. I'm not sure this is identified especially highly in the FTSE stuff. We've much more around concerns about attitudes and relationships than specifically issues around sexual harassment. Claire, I think you're on the call. Is there anything you want to?
So thank you, Jonathan. So I think that's right, Jonathan. What I would say is that we've put a great deal of effort, as you probably know, as governors, into making people aware of the freedom to speak up processes, and encouraging people to come and to talk to us and others about what they want to see in freedom to speak up. So that has been a truly collaborative process, I think. And my feeling is there's quite a lot of confidence building now in terms of people feeling able to raise all sorts of issues. So whilst we're not ever going to know everything, and some people will still find it difficult, I'm hopeful that we're creating an environment where people do feel they can raise concerns.
Thank you.
Thank you. And particularly for staff governors on the call, if we're missing those things and you're hearing them, then we need to know that so that we can address it. Thank you. This wasn't Helen is a member of staff as well as the university representative, but Helen, you were next in the queue, so I'm not expecting you to pick up that issue, but you can, of course, if you wish to.
Thanks very much, Jonathan. I'm actually going to speak with my with both my hats on, because I think it's really helpful to hear what Bruno said about the body cams. But we are also, I think, a pretty proactive organisation, and I speak as someone, as I say, that works in both. We are working with the Trust on developing new programmes of training to support staff in managing what we have termed acute behavioural disturbance, but of course that includes violent aggression, what one does, the de-escalation techniques one can use, and that kind of thing. So those courses are very well received by our staff. They are multidisciplinary and include indeed members of the security team who are utterly fantastic, frankly, in these contexts. But more than that, where some of these more sensitive issues are concerned, we are developing scenarios that incorporate equality, diversity and inclusion issues so that we can have some very explicit conversations about these subjects in a safe, psychologically safe environment. So that's something that's coming up. We're just currently actually negotiating what's going to be within the portfolio of training, but I know people are very keen on this idea. So I guess I would say watch this space. And happy to chat about it more. I'm thinking actually I might try and see Claire about some of this stuff. Thank you. That was all I had to say.
Much. I had Jonathan Wyatt next in the queue. Jonathan. You're on mute, Jonathan.
Okay, unmute.
You came off mute momentarily and you've just gone muted again. That's better.
Okay, am I clear to speak now?
You are, Jonathan, thank you.
Okay. Question for Bruno. When the pandemic first began, one of the things that I can remember was that we had 400 beds for COVID-19. 180 of these beds would be beds which were carrying the extra for people who were really seriously ill. I wondered, was he able to make a comment on how our trust has been able to help the National Health Service generally? Because I remember at another meeting that I heard that there were other hospitals who shipped patients to us because they'd become overburdened, I think in the Midlands and Northumberland and of course in London. Could he update on that? Or if he can't update specifically, could he just make a general comment? That's my question. Secondly, there's an additional piece of information. The problem with security and people losing their temper and throwing about is not something that will be easily solved by the hospital, because it's a matter of a lack of discipline within the schools with the people in their learnings as they grow up. I say this because I had 30 years in practice which covered criminal law and matters, and I could see the population's ability to be disciplined and listen to things and hear people degenerate. And so the hospitals have just been the people who've had to catch the ball on this way. Its solution is a long-term one, but for the hospital itself, I think the way it's happening at the moment, with security teams being able to deal with the people and with the hospital members being given additional training, is exactly the right way. That's all for now.
Thank you, Jonathan. I'm going to discourage you, Bruno, from reference cultural recommendations for the UK as you stepped out in this job, but the point about capacity and helping each other out mutually is a really important one, and I'm grateful for your update on that.
Yeah, Jonathan, when we were in the Delta wave about a year ago, we did provide a lot of aid to other centers around the country, actually. During the Omicron wave, we've not done so to the same extent. There's one exception, for example, in cardiac, we're providing support to Wessex in terms of capacity, but we're also challenged in a number of patient pathways with long waiters. So we're also seeking mutual aid, as we call it, from other centers. For example, from the Portland Hospital on some specific cases that they could help us out with. So there are now very specific services that actually provide mutual aid, where we provide it or other centers provide it to us, which I think is good, because then patients get the fastest access that the NHS as a whole can create.
Speaking with my England and Wales, rest of England and Wales hat on, thank you very much.
Thank you, John. Thanks, Bruno. And just to be clear, that sort of problem is not just about COVID. Indeed, it's not primarily COVID at the moment, is it? The number of COVID patients who are requiring intensive care is not the challenge for us at the moment. It's the fact that the impact of how many people have COVID in terms of staff absences and the number of people we need to treat requires us to work in partnership with people. So that's very different to the Delta wave. Thank you. Sally Jane, you were next, and then Ruby after Sally Jane.
Yes, hello, Bruno. Another part of Boris Johnson's announcement today was that self-isolation he was hoping, finish in a couple of months' time. I'm just wondering if the Trust will feel that will actually need to carry on in the case of staff who actually have coronavirus, even if they haven't got symptoms, and whether that would perhaps be carried on. And if that's the case also, whether that would create a problem for staff, would they have problems financially, if that's being dropped nationally, would that then be a problem for the staff of the Trust?
Yeah, we'll have to see how these measures will be implemented, but at this point in time, I would say the Trust will continue its testing program, which we have been leading from the start of the pandemic. And today that means that all staff members do at least twice a week lateral flow testing. And depending on the outcome of that lateral flow test, we have a whole sort of procedure that they need to follow. If at some point in time, the self-isolation guidelines after a positive test would change, we would review that and see what the implications would be for our staff. But I would expect that we would still, of course, self-isolate staff members that test positively for exactly the same reasons that I responded earlier, that will still have mask wearing and social distancing still being applied in a hospital setting, because we're dealing with vulnerable patients and we want to protect them and protect our staff from infections.
Thank you. That's reassuring that you are going to carry on with that, I think, from a patient's point of view.
And also patients will continue to test, of course.
Of course, yes.
Thanks, Ted. And we have the benefit of having Katie Jeffries as our infection prevention control lead, who is also nationally leading in some of the policy discussions. And we're very, very clear that that's element of safety is central to our decisions. Ruby, you were next, and then it'll be David after Ruby.
Thank you. So I was just going to sort of ask a question regarding back to this sort of assault and abuse within staff in the trust. So you're sort of talking about discussions that would happen after events happened and making people feel safe to talk about stuff that's happened to them, etc. But I was just wondering, because I'm not sure, but is there any sort of education that's going on for people in the more of a sense of prevention and stopping the events from happening in the first place, as opposed to letting people talk about it after it has happened? That's sort of my question.
So I think Helen already alluded to some of the programs that she's helping on the preventative side, trying to de-escalate and make sure that things don't get out of hand. There's also, I mean, quite a lot of focus on supporting staff on how to deal with this beyond what Helen has indicated. So I'm not sure if that answers your question, Ruby, but if there's anything that you feel the trust can do in addition, we take this very seriously. And of course, prevention is always better than having to deal with an incident and then supporting staff afterwards. So anything we can do to prevent escalation would be great if you have ideas that the trust should do on top of what we already do.
Yes, of course. Thank you. I'll have a think. Thank you.
Thanks, Ruby. I mean, I think we're really clear on the trust value at induction and the like, and I don't think anyone would be any under illusions that it's not acceptable to have that sort of harassment. We will get some information, but it'll be quite indirect on staff perceptions from the annual staff survey. And Bruno, I think you reported this morning that we have a higher response rate to the staff survey this year and in previous years, and it's consistently increased a bit over the past few years, and that's very encouraging. We will know more from that when the report comes through, but that won't be for a couple of months. I think that's right, Bruno, before we get the results from that.
And I just want to take the opportunity that any form of unacceptable behavior, because we talked about violence and aggression, about sexual harassment, but also racism. I mean, all of that is completely unacceptable. The policies are very clear. Unfortunately, these things do happen, and we need to make sure that we try to prevent them from happening, and if they happen, that we support staff, yeah, in that case. But as Jonathan and Claire have been saying, it is often discussed at board level, making sure that we can do everything to prevent things from happening, and if they happen, to make sure that we support staff to deal with it.
Thanks, Bruno. David, and then I have Nina after David. David Hayes.
Yes, if it's up to me perhaps to disagree profoundly with Jonathan's assertion that he seems to hold the schools primarily responsible. It's a hugely complex subject. Schools have a part to play, but by no means the major part. You know, the growing and extreme inequality in society, I would put up there, the pressures of the pandemic, but that's all a discussion for another day.
Thanks, David. I mean, we have enough on our plate already without solving that problem or getting into that debate. I'm going to move swiftly on to Nina.
Thank you, Chair. Just a very quick point in support of what Ruby just said. I think that she made a very valid comment, and it would be extremely useful for established people, such as people of my generation and perhaps a bit younger, to take into account views that people like Ruby can bring in terms of improving the procedures going forward, because I think we can get very comfortable about the procedures that we already have. And I recognize the training that Helen Hyam has described very succinctly. But sometimes these behaviors arise not due to a lack of training, not from a lack of understanding of what is acceptable, but it is as it was in Jeffrey Epstein's case. These are mentally sick people themselves. So these people need more than just those ordinary preventative barriers that would work in normal circumstances. Thank you.
Thank you, Nina. So we've sorted the education system, we've now sorted the criminal justice system, and I'm going to move on to Jules.
Yes, hello everyone. I just wanted to add a comment that I have been in ED for 26 years and I've been a nurse since 1985. And I think what we're talking about is very complex, the presentations, and it's not just the patients, it's also the relatives. And I think I talk to a lot of other trusts on a daily basis, trying to get patients back to their correct hospitals. And I think we are well above the curve compared to most hospitals. So the body cams has generated quite a lot of discussion. And I'd just like to say and give you all assurance from somebody who spends a lot of time in ED and walking the corridors, we are probably one of the safest organisations, especially in the Thames Valley, and our security is absolutely fantastic, and my team work with them on a daily basis. And I'm not going to get into the politics of if it's the upbringing, whatever. I think it's so multifactorial, you couldn't possibly discuss it in an hour and a half. But what I would say is the impact sometimes of relatives that ring up who want information that you can't provide, the abuse you sometimes get on the phone is more detrimental in some ways than somebody that you're facing, not just in ED and on the wards as well. But, you know, I feel completely safe in the organisation, and, you know, I think we are doing a fantastic job to protect staff. And I just wanted to let you all know from a staff perspective, we are wonderful. Thank you. That's all.
I'm inclined to close the meeting at that point, but I can't. I mean, I think, Bruno, we would agree that staff are entitled to feel safe at work, though, and it's part of our job to create a culture in which that's true. I ought to move the agenda on very shortly, but Bruno, before I do, could I just ask you to say a little bit about the impact of Omicron on the non-COVID services? So we were briefed a little bit earlier on in the board to the fact that we haven't had to have wholesale cancellations of procedures as some places have had, and I just wonder whether you can quickly say where we are in terms of our waiting lists and our the reduction in the long waiters, because we heard some impressive work going on this morning.
Yeah, I mean, it's thanks to all the staff who've been working relentlessly, not just because of the COVID impact, but trying to keep all the other services going. And I mean, we're a large and complex trust with an enormous breadth of services covering Oxfordshire, the Bob ICS, Thames Valley, and in some cases national services. There's specific services, and we've talked about those before, that even before the pandemic, we had a demand capacity imbalance, and so we had growing waiting lists that, of course, only got worse during the pandemic. But despite those imbalances, I think people have been really focusing on, of course, the urgent emergency cases, but also the long waiters. And we were afraid at one point in time that the number of people that had to wait more than 2 years for their diagnostic and treatment would be a large number. And of course, we're still trying to work very hard because we've committed to a certain reduction by the end of March. And we'll still have some patients that will breach that 2-year wait period, but it's going to be a lot less than we had anticipated, given that Omicron would get us off track. But thanks to a lot of flexibility and focus on making sure that we allocate the capacity to the right patients, I think will be indeed in a better place than we had feared when we knew Omicron would hit us.
Thank you, Bruno. Are there any other questions for Bruno before we allow him to get on with other work? Bruno, thank you very much. And would you pass on thanks to the council to your colleagues and to all our staff for continuing to work through in this difficult phase? We really appreciate it.
Yeah, here, very strongly support that.
Thank you.
Thank you. Enjoy the rest of the meeting.
Thank you, Bruno. Thanks so much, everybody. I'd quite like to be as quick as we can on the next few items so we can create the space to discuss the chief executive recruitment. So the next item, item 6, is the future arrangements for committees. And I'm grateful to Cecilia, Sally Jane, Anne and Joy for getting together to talk about this. And there are some specific recommendations which their group is making to us. I don't know if Cecilia, do you want to speak to them or invite one of the others to speak to them?
You're muted, I think.
Yes, is Anne on the call as she chaired the meeting? I wondered if she would like to, because I'm sorry, I haven't got the paper right in front of me.
That's fine. Anne was here, but I'm not sure she's here at the moment.
You can see her. You can see her.
Anne, are you with us?
Yes, I am. I also don't have the paper in front of me at the moment.
I do. So there are 3 recommendations that you came up with. The first recommendation was that the system we put in place previously of some of the new governors shadowing into the committees, that we should regularise the succession planning that's there by inviting those who've been shadowing to consider becoming members of the committees. Obviously, they're not obliged to, but that would be consent. That was the first recommendation. Second recommendation is that we should undertake an exercise like this on an annual basis, so that we should review the committee memberships and make sure that we keep experience, but also opportunities for new governors to come in. And the third recommendation was that we should identify amongst the non-executive directors 2 or 3 to be regularly attending one of the 2 committees, PMQ and PWF. They all seem to me, if I may say so, eminently sensible recommendations. And if the council as a whole thinks similarly, I would be encouraging the council to accept them as opposed to debate them at length, because that will enable them to talk about, I think, more useful discussion points about chief executive recruitment shortly. Cecilia, I hope I've captured the thinking there.
Yes, that's fine. I apologise for not having prepared that. But what I would like to add is we saw great value in actually at committee meetings having particularly one topic that we explore in depth, and not having too much, definitely trying not to repeat any work done by the board, and also to actually have a more active engagement with the non-execs. We sort of we applied that model to our last PWF, and I think we should ask Anne or any of the other non-execs who are on the call. We spent a lot of time talking about. I'll tell you about what it is about the subject, but we had active engagement of the NEDs, talking to the executive directors, talking to the governors, and we truly saw them at their work seeking seeking some doing their job, should we say. The words have gone for me now as I'm unprepared, but anyway, it just seemed of great value to work like that. Seeking assurance, that's the word.
Thanks so much, Cecilia. And I'm going to take it that that's also the report for PWF. So that will enable us to move that agenda item on later, where you focused on, in different meetings, system urgent care, theatre productivity and wellbeing, and had, I think, very good discussions because you limited the agendas to particular areas. Anne.
I just wanted to add to that. I think the other benefit from a non-executive point of view with this approach is that it gives the non-executives a better chance to understand, perhaps in a bit more detail, some of the challenges in their individual communities. So if you start building this rapport between the committees and a number of non-execs, I think it allows that kind of dialogue to develop, and there is a two-way benefit. So there's a benefit for the governors to feel that they are able to understand how they can hold the non-execs to account, which is clearly an extremely important part of their role. But it also gives the non-execs an opportunity to interact in a semi-formal way with the governors, which I think is also beneficial for them in order for the non-execs to be able to do their job better. So I just wanted to add that about why I was particularly keen on this proposal that we developed.
Thank you, Anne. I can see quite a lot of people nodding. I can't see everybody because I can't see everybody at the same time. I'm going to take it then that the council accepts those recommendations unless anybody. Okay, that's great.
Yeah.
Item 7 is the management of staff governor vacancies. So one of the people elected as a staff governor is no longer working in the trust, and there is what I think is an excellent and pragmatic proposal that because we are already going out to elections, that what we should effectively do is to regard in those elections we have an additional staff governor place to fill. The staff governor who comes top of the ballot will get a 3-year term under this recommendation. The staff governor who is second in the ballot would fill the vacant place, and that would mean they got a 2-year term. Seems to me that's as close as we can get to a democratic mandate and a very sensible, pragmatic solution. I can see a lot of nods, so I'm going to take it that we've agreed that unless anybody disagrees. Thank you.
Excellent.
I think we've heard, Cecilia, about PWF. Was there anything else that you need to add about PWF? And the item after that is lead governor report. So you have a chance to do both of those now. You're on mute though, Cecilia, so we won't hear you doing it.
Guys, I apologise. I feel like I'm in a race. Basically, yes, the major thing we concentrated at PWF recently was on staff wellbeing, and there was a great attendance. It was headed up by our Chief People Officer and senior members of his team, and we had the Clinical Director of Psychological Medicine along, and we were told about the progress since the last update provided to the council in January of 2021. I just really, there's been, we saw lots of evidence of how cultural changes have come about in ways of working, and there was a very good slide presentation, and I think the most effective way we can to update you on this is to circulate the slide presentation, and I'll do a little introduction to it so you can see what's going on, particularly in view of all the COVID stress of late. Thank you. Oh, my lead governor report. I shall go on to that, and can I just say, actually, most of that, in fact, all of that was around the Bob engagement for public with the other lead governors from other trusts. So there we are, it's dealt with.
Thank you very much, Cecilia. Are there any questions that people have on either of those two items? We've touched on both of them earlier in the meeting. Sally Jane.
Yeah, sorry to interrupt here. I was just going to point out that there isn't a report from the PEMQ committee because we tried twice to hold a meeting, and understandably the relevant executive directors weren't available to come. So we will be meeting next week.
Thank you very much, Sally Jane. I was also going to point that out as well as why there wasn't an agenda item, so I'm grateful to you. Okay, I'm not aware of any other business for this part of the meeting. Anita.
Sorry, just really to follow up with Cecilia's comment, I think I would be really, and I know because I've discussed it on the telephone with other colleagues, with other governor colleagues, it would be really helpful for us to have a much clearer picture of many of the, albeit quite briefly, of many of the events or the many of the involvements and discussions, meetings that you as lead governor have, because we don't really have much notion as to what really mostly you do. Thank you.
So Anita, that's exactly what the point of this agenda item is, and I think you do get at each meeting that information. I mean, the points about the ICS are that they have been very hurriedly arranged at short notice, and as soon as there's been a chance to feed them back, Cecilia has done. And as you said earlier, Cecilia, these all happened over the holiday period, didn't they? And we're grateful you managed to get to them. Cecilia.
Yes, just to say it was not only just me from our Council of Governors representing. We had Martin and Graham has been involved and Sally Jane.
Oh, right.
So yes, it certainly hasn't just been exclusive to the lead governors, particularly in the interaction with OUH.
Right, thank you. Thank you very much indeed.
Nina.
Just really picking up on Anita's point, and I appreciate what Cecilia had to do in the holidays under a lot of time pressure. But like Anita, I was not aware that there was a need for governors to actually engage. And had I known, perhaps I would have liked to have volunteered. But that's for the future.
May I just respond to that, Nina? It's not that there's a need, we're pressing for a need. There has been an absence of a desire to engage. We have been trying. So it's just been to do some preliminary work to get some response from the ICS, which of course itself has only just come to be with a chair and an appointed CEO. So it's, bottlenecks at both ends.
Yes, sure. But my point about the need was to support you. If you felt there was a need from our side to support you.
I think, Nina, we anticipate there will be in the relatively near future some opportunities to do this, but that's suddenly emerged, hasn't it, Cecilia? I've got Martin, and then I'm going to try and move us on. Martin.
Well, I was only just going to say that there have been informal discussions between individuals over quite a long period, and we've certainly talked about them at council meetings. I mean, I think a lot of us have felt it would be great, even before the ICS became a reality, to have better relations between governors in different areas. And I mean, it goes back to a public meeting, which I think several of us attended, which was, 2 or 3 years ago, even more, where we happened to come across other governors and had interesting and fruitful discussions. I don't think there's any sort of secrecy about it. I think it's just that the appearance on the horizon of a real ICS organisation has suddenly got other people to respond. But it's been a long time in the desert in the meantime.
And I hope flowers are beginning to bloom, Martin. So let's make sure that we take those opportunities, because the council's been pushing for them for a while. Look, I would like to move on, I think, now, because I think it would be really helpful to have as much time as possible for the council to discuss chief executive recruitment. So I don't believe there's any public meeting business. Our next meeting as a council in public will be in April.